We're going to go over a medication kit that we might take on an expedition or stock at a remote cottage, camp somewhere. So this includes the commonly used over-the-counter available drugs to the public that you can take with you to help manage symptoms while you're waiting for further medical care, or you're just stuck out there and trying to manage more minor complications. So first thing we recommend is bringing the Wilderness Remote Medication Guide. So this guide actually goes through all these medications. It talks about what they're called, what their uses are, cautions, and dosing. And that's all on waterproof paper. It's even got some area where you can document what you have in there as an inventory, when you've used it and given it to a patient, and how to talk to higher level care. Say you had to call telehealth or call EMS. It helps you organize your thoughts. And then there's some important numbers on the back. So if you needed to call for poison control, search and rescue, crisis lines, and you can even add your own personal information there. So that's the first thing we recommend carrying in your kit. Then we go through medications by category. So for pain meds, we like Tylenol. Tylenol is a pretty safe drug. You can get that in a number of sizes of bottles. This is a good size bottle to carry, so you got lots of doses here. Then ibuprofen, again, a pain medication. These two can be used together or separately, depending on how you want to use them for muscle aches or headaches. You can even use them to treat fevers. Then we have here Oragel. So this is a toothache pain relief, and we've included some cotton swabs there so you can put this right on the tooth. But this is really helpful for chipped teeth, cavities, any sort of dental pain. This is an awesome little saver because those are quite painful. Then for anyone with low blood sugar, we're thinking diabetics that are there. We have our quick and easy to use glucose gels. So you can just take one per low blood sugar treatment, and it's going to quickly raise someone's blood sugar. For dehydration, we have electrolyte packets, and we like these Tri-Oral ones because they're nice and easy. There's no measuring required. You just put an entire packet in 1 liter of water, and they're based on the World Health Organization formula for rehydration. So we've got a few of those. Then we got some Pepto-Bismol tablets. We like these better than the fluid. They store better, they travel better, and these are good for all of your, Pepto symptoms: heartburn, indigestion, nausea, upset stomach, diarrhea. So you got lots of those in there. Then we got Tums for any of your heartburn issues. So again, some nice tabs, easy, portable. Then we get into constipation being a big issue, especially remote kind of camping. And Restorelax is kind of our first line treatment. So again, we like these packets because they're individually dosed and they're easy to administer. So you just rip this packet, add it to the water, and you take one of these once a day until you've kind of resolved the issue. And they're fairly low on the caution side. So a really good device to use. Then if you wanted to go a little bit more potent, you can use laxatives like Senokot. These are given at night, and again can help with constipation. If you have the opposite issue, diarrhea, we have loperamide. So this would be used really if you had someone with diarrhea that you needed to get to medical help, or just contain fluids until they're going to get further treatment. You can give this to kind of slow down or halt that diarrhea until they're further assessed to see what the cause is. Then for some nausea medications, this is great for motion sickness or just general kind of nausea. This is Gravol or dimenhydrinate, and you get a few tabs in there. We like to keep things in the original packaging if possible, so we've just kind of broken down this box so that you still have all your directions and cautions on it, as well as your dosing instructions, but it makes it nice and thin to pack in a kit. Then for creams, we carry an antifungal cream. So this is great for a yeast infection, athlete's foot, groin itch, any of those issues. That's called clotrimazole, or another brand name would be called Canesten. Then for your anti-itch creams, this is great for poison ivy, any sort of contact allergic reactions to the skin. This can be applied and helps reduce that itching, really bad bug bites. So this is hydrocortisone, and you can get it as a 1% or a 0.5% over the counter. Then to prevent infection with any little cuts and scrapes on your skin, there's triple antibiotic ointment. So this would be commonly called polysporin, but again, you can buy it as a no name as the triple antibiotic ointment, and you can apply this right to the skin or put it on a Band-Aid or a bandage you're going to put on the skin. and then apply it a few times a day as you're changing it and managing it. And it can help with pain as well as reducing the chance of infection. This right here is a training device. We don't have a real one with us. We don't generally have allergies when we're personally tripping, but if I was tripping with those that did have allergies or I had people with them, you can buy EpiPens at a pharmacy. They only last about a year and a half, and they will come in their own case as well. You got to be cautious; they're temperature sensitive, but this is really good if you have someone with any anaphylactic concerns, and generally it'd be ideal to carry 2 of those. Then for more mild allergies, we have Reactine. This is nice because it's non-drowsy, so you can give it and you're not going to be making the patient sleepy all day. And it's a once a day dose. So you got quite a few days in there. And again, original packaging, just kind of broken down. And then for more quicker allergy relief, again, for mild allergies, you can get Benadryl, which is diphenhydramine. This does carry some drowsiness side effects, so just being aware of that. But it's a nice, quick to give, more commonly given for allergic reactions in conjunction with your epinephrine. Then for general sore throats, we've got some cough drops. These are great just to keep people nice and happy. You can also do saltwater rinses for those just to keep them going until those symptoms generally self-resolve. And then for your eye-ear infections, Polysporin makes an eye-ear drop. So this is great for pink eye or ear infections, and you've got dosing information right on the bottle there. So this is an awesome one for any of those little eye irritations or minor ear infections. So this is our medication kit. And we do sell the case with the guide all set. So it kind of gives you a shopping list of what meds you can look for. And this is now available at wildmedkits.ca.